You must have seen in movies and TV series that when there is no other option left, doctors recommend bone marrow transplant to cure some diseases. And after this transplant, most of the people are cured miraculously. But apart from these fictional events, have you ever wondered what is bone marrow transplant? How is it performed? Is it a painful process? And can you become a bone marrow donor? Today we are going to dwell upon these and many more questions which everyone wants to know about the bone marrow transplant. First of all, you must know that bone marrow is a really important organ in our body. As we have already discussed in one of our previous videos, the bone marrow performs many vital functions. For example, production of blood, bones, muscles, cartilage, etc. But when it doesn't work properly or becomes non-functional, the situation can become life-threatening. There can be many reasons behind bone marrow becoming dysfunctional. For example, cancer, lymphoma, infections, aplastic anemia, sickle cell anemia, etc. In such conditions, it becomes necessary to transplant healthy bone marrow. The process of bone marrow transplantation is same as the blood transfusion. The first step of transplant is to find a suitable donor. In some cases, like when you are going for chemotherapy or your bone marrow is becoming non-functional, doctors can take stem cells from your body and store it for later transplantation. This type of transplantation is known as autologous transplantation. If you have an identical twin, then he or she can also donate you bone marrow. This type of transplantation is known as syngeneic transplantation. And when these two options are not available, you can turn to third option, which is also known as allogenic transplantation. In this type, your siblings, parents, family members, or people who are not related to you can donate you bone marrow. But the donors have to go through a test known as human leukocyte antigen tissue typing or HLA test. In 30% of cases, a family member gets matched in HLA test. Rest of the people have to search for bone marrow donors via donation drive or bone marrow registry. After getting a suitable donor, we get to the second step, which is extraction of bone marrow or stem cells. There are two methods for this. In the first method, stem cells acquired from hip bone, ilium, are transferred from one person to another. But in case of children, stem cells can also be taken from sternum and upper tibia. In the second method, which is known as apheresis, the donor is given an injection or medication for 5 days. This increases the production of stem cells in their bloodstream. After 5 days, the donor's blood is removed from one arm to a machine where the stem cells get separated from the rest of the blood and this filtered blood is returned to donor via second arm. While the first method is performed under anesthesia, the second method doesn't require it. The donor doesn't have to go through a painful process in both of these methods. So bone marrow donation is a painless process. Next step in the transplantation is known as conditioning regimen. In this step, patient's diseased stem cells and entire immune system is destroyed with the help of treatment which may include chemotherapy and radiation therapy too. This step ensures that the body don't attack on new transplanted cells. The final step in this process is transplant. The stem cells received from donors are transfused to recipient's bloodstream via IV line. Later, these stem cells settle down in bone marrow and they start generating new cells. While this process is simple and easy to understand, it can have some side effects too. Sometimes new cells do not settle in patient's body and they start attacking their body. This is known as graft versus host disease. Besides this, the recipient can develop anemia, bleeding in lungs and intestine, cataract, clotting in small veins of liver, and delayed growth in children. The chances of developing these conditions depend on several factors like your age, overall health, disease, and type of transplant, etc. The bone marrow recipients and their family should also remember that the immune system of recipient is really weak and it is really easy for them to catch infections. So they should clean their house properly. The guests should wash their hands before meeting the patient. Special attention should be paid in preparing food and taking care of pets. On one hand, many of the patients get bone marrow transplant and their life gets saved. On the other hand, many patients die waiting for donors. So share this video with your friends and family and make them aware about the bone marrow transplant. And if possible, register yourself with Bone Marrow Registry and become a potential donor. Remember that anyone can become a donor. And for more such interesting videos, subscribe to our channel and press the bell icon.